Hey guys, my name is Ali Seferino, and today's video is going to be about finding an ethical addiction treatment center. I'm bringing you this video through Addiction Helpline America. Addiction Helpline America is a super awesome resource. It's a total online directory that lists every single addiction resource in every single state in the United States. Yes. So if you need any sort of help for yourself or a loved one, it's a very easy site to navigate. You just go to addictionhelplineamerica.com, put the state that you're living in, and find the resources near you. You can speak to an addiction professional who can help you assess your needs, and you can also read a ton of literature at your leisure that's on the site. So I hope that you really like this video today. Today's video is going to be on ethics and how to find an ethical rehab center. I think to start this video, we really need to talk about the word ethical and what it really means. It's because there's tons of business owners that operate every single day without breaking the law, but they might not have a solid moral compass, which is really what ethics are. And in the addiction treatment industry, this is very serious because there's going to be a vast array of decision makings that happen every single day that's going to require sound moral compass. During these decision making processes, you're going to want someone who's working there who's ethical and professional and who really understands the disease of addiction. In the addiction treatment industry, there has been rampant fraud,
arresting 77 people accused of $141 million in false billings,
patient brokering, kickback schemes, urine testing, and illegal enticements that have just consumed the industry. So before you go to a treatment center, it's really important to ask the right questions to get a good grasp on whether this facility is the right fit for you. I'm going to go over a list of some questions that I think you should definitely ask a potential rehab center before you enter their doors. And I think the first question should definitely be, what are the credentials of your staff? So a rehab center is going to have an array of different staffing. I mean, it goes from medical director, clinical director, nursing director, behavioral health technicians, peer supports, drivers. I mean, there's a lot of different people who work at these facilities. So we really want to know, are all these people getting their background checks done? You want to make sure that the therapists are master's levels, especially the clinical director should definitely be a master's level clinician. Really, the people that are going to be with the patient more than anyone else are going to be the behavioral health technicians. And in my experience, they play the biggest role in a lot of patients' recoveries. So we want to make sure that they are, doing the right thing themselves, that they are educated, that they are certified, and they know how to act without judgment in a emergency situation. They are CPR certified, etc. And so I would definitely ask all those questions before walking in the doors. There's going to be so many different patients that walk in from so many different walks of life. Some will be coming in from mansions while others are coming in right off the streets. Every single person that works at a treatment facility really needs to be professional when it comes to this and not treat anybody differently based off the severity of their addiction or the things that they've done in their past. The next question I would ask is, what kind of treatment do you provide? Every single facility should have individualized treatment. They should do some sort of evidence-based treatment. A long-term alcoholic should be treated differently medically and therapeutically than somebody who might have been a young person who may be using opiates. When it comes to individualized treatment, this is probably one of the best times to talk to an addiction professional, which you can do over the phone on our website anytime. Because an addiction professional will be able to steer you in the right direction. They'll be able to ask the right questions like, are you dual diagnosed? Do you have any co-occurring disorders like anxiety or depression or bipolar that go along with your addictions? Have you ever been treated for these before in the past? Do you have a primary psych disorder or a primary substance use disorder? Because the treatments are going to vary depending on the answers to these questions. Are you a long-term alcoholic, or are you an IV drug user? Are you a chronic relapser? These are questions that should definitely be asked and taken into consideration before finding the rehab center that's perfect for you and your needs. All great rehab centers are going to have individualized care. They're going to have different tracks for different people. These tracks include different age groups, different drugs of choice, and even different faiths and religions. Some people want to do evidence-based treatment while others prefer holistic therapies and others prefer faith-based therapy. And a lot of addiction facilities actually offer all of these things. They have music programs, they have adventure programs, they have outdoor programs. And so to really see what would work best for you, your mind and your body, it's really important to ask these questions and to make sure that they really truly have individualized care and they're not just giving the same care across the board, because different modalities are going to work for different people. Good treatment programs tailor their services to the needs of the client. You also want to ask about family involvement. Family involvement can be critical to somebody actually getting better. Beyond just family involvement, what kind of family education is there? Some of the best rehab centers around the country have awesome family programs where families can come in and learn about the disease of addiction, get a grasp on what their loved one is going through, and with that educational material that they're given, they're really able to support the person they love when they return home from treatment. Every treatment facility should also give some sort of relapse prevention planning. So critical. Recovery does not end when you walk out of the doors of a treatment center. It's only beginning. Life gets hard when you leave those doors and you're back into the real world and you have to get a job and maybe get your license back, deal with husbands, wives, kids. You're gonna be faced with all of these things when you walk out of the doors. What are you gonna do? Do you have a relapse prevention plan in place? Just like any other disease, people usually need to make lifestyle changes to stay healthy. Relapse happens. Just because somebody went to treatment and relapsed after they left doesn't mean that they didn't learn anything there. But there needs to be a plan for when that relapse may happen. A way that the family reacts and an idea for the patient, somebody that they can contact immediately, that they feel safe talking to, so that the relapse is not prolonged and hopefully they still have a chance to turn their life around and live their life. Long periods of abstinence followed by a relapse can really increase the chance for overdose, and so it's just something to really consider when talking about someone's relapse prevention plan and their aftercare plan moving forward. As far as aftercare goes, there should definitely be, if the person went out of state to get treatment and they're going back home, before they go back home, we should really be looking at resources near them that they can utilize once they go back home, whether that's meetings, a therapist, smart recovery, a faith-based recovery program that they're able to enter when they go back home, so they have that support that reminds them of why they're sober and gives them people to lean on when they're really having hard days. Improper planning will support performance, and that brings us to our next question, which is, what is their outcomes? Even though these outcomes can be very hard to track because so many people come in, relapse rates are very high, and it can be hard to keep in contact with every single client that's been through your facility. It's nice to know that a treatment facility is taking the extra time and effort to try and track their outcomes. There are different systems for tracking outcomes, and every single rehab facility has the ability to purchase these systems and to utilize these systems. And I feel when they're utilizing these systems, it means that they truly genuinely care about the outcomes. They're looking to see what they could do different to have greater, better outcomes, and they're always working on bettering themselves, which for every single person, that's a good thing. And I feel that's the moral, ethical thing to do, especially when the relapse rate is almost 90%. There's a few extra steps you can also take to making sure that you're picking a reputable, ethical treatment facility for you or your loved one. Now, I know this isn't always possible, but after asking all those amazing questions over the phone, if you can, go check out the facility in person. Sometimes it's not going to be down the street, but if you do live nearby, drive by. Make sure that it's the same place that you see online. Make sure that it's clean. Just like if you were picking a nursing home for your mom or dad to go to, what are the things that you would look for? You would look for cleanliness, kind staff, educated staff. What do the patients there look like? Do they look like they're taking care of themselves and their hygiene? Does the place look overall nice, clean, like a hospital would? And I would ask the staff, do they love their program? Do they love their job? If you're able to talk to them, ask them what they truly feel about the treatment that they provide for their patients there. I feel more often than not, you'll be able to read their facial expressions and get some good insight from the staff that works there. If you can't go there, another great thing to do is look at reviews online. Of course, there's always going to be a disgruntled client. That should be no surprise. But if you see a pattern of negative reviews over and over again, I would really take caution to that. And I would definitely ask the facility straight up what it is that these people are talking about and see if they have any valid excuses for it. Also, I would pay attention to how they respond to all of these reviews. And remember that it is a HIPAA violation for them to say that anyone was ever at their facility. They're not allowed to say that Billy entered our facility or when you were here, XYZ. That is a blatant HIPAA violation. And so you want to make sure that they are professional enough and ethical enough to know that you can't say that stuff on the internet. Also, if you know anyone who has ever been to this treatment facility, ask them how their experience was. Did they love it? Did they get the treatment that they thought they would? Did they get a lot of individual therapy? How was the family therapy? Did they follow up with you for aftercare? What did your aftercare plan look like? and was it successful for you? Beyond going there in person, checking their reviews, and making sure that all of their online content looks super professional, I would make sure that they also have their CARF and JCO accreditations up to date. That's it for this video, guys. I hope that it gave you some great questions to ask and things to look for when looking for an ethical treatment center. If you have any questions that you think that I missed, comment them down below. I would love to hear and read your comments. Please like, share, and subscribe, and let us know what video you want us to do next. I hope that you all have the best day ever, and remember, if you need anything, we are here for you 24/7 at addictionhelplineamerica.com. Bye, guys.